Easy or difficult? So. No response. How much? How much percentage you guys understand? I wanna see you guys understanding or not. Last class we discussed about types of epilepsy and what the difference between epilepsy and seizure, classification of epilepsy, what are the causes for seizure. So let me know what are the causes for seizure. What are the causes for seizure? Tell me any five causes for seizure. I already explained if convulsion or tremor has no cause, then it if you have cause, it's known as seizure. So let me know about five causes. First one,
Electronic electrolyte imbalance.
electrolyte imbalance, for example, sodium, potassium, magnesium, calcium. Which two very important parts is it? Number one, magnesium. Number two, calcium. Must keep in mind. Okay. If any baby having seizure, newborn having seizure, what will be your first investigation choice? Must check electrolyte first. Okay. First investigation. However, other cause, hypomagnesemia, hypocalcemia is very important cause for seizure. Any other cause?
Tumor infection.
Okay, tumor inside the brain, infection. Next, cyst,
Sis, trauma.
brain
Oh,
abscess, cyst, trauma. Okay, so these are the causes for seizure. How you find out the cause for seizure? Like serum electrolyte. We need GBC one. Another we need CSF examination for lumbar puncture. Not lumbar puncture. We need CT or MRI. Must start from serum electrolyte first. Okay. Then try to find out the cause first. If still no cause, known as idiopathic, it's not seizure, it's epilepsy. Epilepsy category we already done, partial and generalized. Okay. What is the most common type in children?
Absence.
Absence in children. What type of channel involved? What type channel problem? L
and
type calcium channel. Where is the problem in brain? One question, most common in children. Second question, most common the channel involved here. Third question from this area of the brain. Uh, how about drug of choice? Drug of choice. Nitrosuccinimide, first option. Okay. Second option, valproate. Third option, valonazepam. Okay. These are both options. Most common type in overall common type for adult. Tonic clonic, atonic, myoclonal. Myoclonal. Tonic, colonic, eight, colonic, myoclonic. Okay. And fourth one, febrile. First one, tonic, colonic. What's the most common from these four? Tonic. What's the name for tonic, colonic?
Grand Brenham.
Mal. How about upset name?
Petit Mal.
Is it mal? Okay. What word in rug? First one, Arba, Messi. Okay. Not mixed with chlorochromazine. Okay, understand? Chlorochromazine. The first line is a real sodium blocker. How about this chlorochromazine? Cause antidote. Understand? This part, psychosis, carbamazepine, mazepine, chloropromazine, flupanazine, triflupanazine, promethazine, prochloroperazole, and zine. Yeah, these are antipsychotics. Antiepileptic carbamazepine. This we use for partial seizure. Okay, this we use for partial seizure or partial seizure. In case of partial seizure, it's one use for it's another important use must keep in mind for neuropathic pain, trigeminal neuralgia, trigeminal neuralgia. Okay, drug of choice for trigeminal neuralgia, carbamazepine. Drug of choice for trigeminal neuralgia is carbamazepine. Clear, clear. Carbamazepine uses these uses. How about the side effects of carbamazepine? SIAD. It's an important side effect. Carbamazepine important side effect SIADS. A high release of what the ADH is doing. H2O absorption from kidney. This antidiuretic part. Yeah. So what happened inside the body? Solution because more water there. So what happened with sodium? Going down. So in SIADH patient, the patient having hyponatremia. Hyponatremia. Clear? Hyponatremia is the problem with carbamazepine because release very high level of SIADH. Clear, clear or not? High level of SIADH. So this drug, all the one thing keep in mind. I give first general idea about P450 system. Okay, the enzyme belongs to P450 system. Phase one reaction and phase two reaction. Okay, so all the enzymes is stimulated. Write a general idea by cholesterol. Okay, and this enzyme system inhibited by firstly GAT drugs. Okay, inhibited by GAT drug inhibited by TB drug, inhibited by antifungal drug. So focus here. So CNS drug, you already done benzodiazepine. Yeah, you already done barbiturate, if you remember. And third group here, epileptic drug. Epileptic drug. So all these drugs are doing what? They increase the activity of P450 system. So this phase 1 and phase 2 reaction become faster. So if you're using these drugs, CNS drug, and patient also taking antibiotic, patient also taking anticoagulant, patient taking antihypertensive, any other drug, if you use with CNS drug, what happens with other drugs? The other drug metabolism become faster. Understand? Because the CNS drug doing what? CNS drug they stimulate P450 system. CNS drug they stimulate P450 system. So if any patient also using other than CNS drug at the same time, using antiepileptic, using an anxiolytic, okay. So what happened for other drug? The other drug metabolism become more faster and drug become inactive. Drug become mostly inactive. Understand? So we must increase the dose of other drug if you want to use in combination with CNS drug. Especially CNS drug, benzo and barbiturate and anxiolytic and epileptic. It's a very important point about this drug. The inhibitor, GAT drug we have been is an inhibitor for P450 system, H2 blocker, H2 blocker, and PPI, and PPI, and antifungal. We also antifungal azole family, azole, okay, PPI azole, and TB rifampicin, rifampicin, rifampicin. Okay, so by easy way you can keep in mind GAT drugs stimulate, sorry, inhibit P450 system, and CNS drugs stimulate P450 system. So if you're using any other drug with a GAT drug, so we must decrease the dose of that drug. Why? Because metabolism becomes slow for other drugs if you use in combination with H2 blocker in combination with PPI. Understand? This general idea is written in your pharmacokinetics, pharmacodynamics lecture. The P54 inhibitor. At that time, just memorize like that, so it's very hard to memorize. Now you have idea, have the concept about this. The CNS drug they are stimulating. What type of CNS drug? Benzodiazepine, anxiolytic, and anticonvulsant. Understand? And the GLT drug, especially H2 blocker and PPI. PPI also azole family, also azole family. Okay, azole family is very easy to keep in mind. Azole. Take the name and add the azole. It's me like ketoconazole, the antifungal drug. Okay, itraconazole, antifungal drug, clotrimazole, antifungal drugs. Okay, so these drugs they inhibit P54 system. Omeprazole, pantoprazole. So these drugs they inhibit P4 system. Ranitidine, cimetidine, these are the H2 blocker. This we again discuss when we talk about the GRT pharmacology. Okay, now stay here on CNS system. Benzodiazepine, barbiturate, and anti-epileptics. So carbamazepine belongs to epileptic drug, anti-epileptic drug, doing what the stimulate the P450 system. Okay. So if you're using warfarin, if you're using heparin or anticoagulant, so very important to adjust. If you're using antiarrhythmic drugs for heart patient, you must adjust the dose. Why? Because CNS drugs they increase the metabolism of other drugs. Yeah, they increase the metabolism of other drugs or interfere with other drugs also because they stimulate P4. That's an important idea. Understand? It's an important concept about carbamazepine. So carbamazepine stimulate P450 system also. And another thing, carbamazepine and phenytoin, valproic acid, they also consume folic acid. Consume folic acid. So if you remember eclampsia, if you remember eclampsia, I already explained in hypertension like adrenergic drugs, with adrenergic drug, what's happening in eclampsia. Eclampsia. pregnancy, preeclampsia. Eclampsia, preeclampsia, the female preeclampsia having pregnant lady having proteinuria plus hypertension. Yeah. Now that lady also having in case of eclampsia, proteinuria plus hypertension. What is the drug of choice for hypertension in pregnancy? Not answer me is now. Let's get
L-Dopa, sir.
Haldopa.
Labeta,
Another labetalol.
labetalol.
Good, good. The remaining drug we will discuss in next serious lecture. Okay, we have 3-4 drugs we can use in pregnancy stage. Okay, proteinuria, hypertension, and seizure. This happen in eclampsia. Understand? To control seizure, we need to use these drug, anti-epileptic drug for seizure. Done. So, which drug we can use for seizure? Which drug? If the mother having epilepsy history now conceived, she conceived now. So, if the mother still using anti-epileptic drug, what happen? Because this anti-epileptic drug they consume folic acid, so deficiency of folic acid. If you remember the neuroembryology, neuroanatomy, how the develop neural tube change to mesencephalon, prosencephalon, telencephalon, diencephalon, lot of parts there. So folic acid deficiency it lead to effect, neural tube defect, spina bifida, and anencephaly. Spina bifida and anencephaly. So anti-epileptic drugs, especially carbamazepine, phenytoin, valproic acid. Anti-epileptic drugs, especially carbamazepine, phenytoin, and valproic acid. Okay, so these 3 drugs they also lead to also causing what? Folic acid deficiency in pregnancy. So, if the mother have epilepsy or develop seizure while pregnant, eclampsia, the now pregnant lady develops seizure is called known as eclampsia. Without seizure, just hypertension is just a preeclampsia. Okay, there's a difference between preeclampsia and eclampsia. If the mother already have history of epilepsy, now she conceive and have the attack epilepsy, now need to control the seizure in the lady. So if you still using these carbamazepine, phenytoin, valproic acid, so these drugs doing what? They consume folic acid. They consume folic. Understand? Okay, it's a very important side effect. Another side effect. So another side effect, if you know about development cleft palate, it's a problem with development of hard palate. Like above here we have nasal cavity, below we have oral cavity, okay. Above we have cranial cavity, here nose. So now there the floor here, the upper palate here, yeah. The oral cavity, the nasal cavity. So this thing is a roof of oral cavity and floor of nasal cavity. So which bone here? Maxilla. Which bone here? Maxilla femoris, especially. It's also known as hard palate. Yeah, hard palate. Lateral process of maxilla this side. Here have some defect. The baby have open like upper lips also not formed. Upper lip of the baby also not formed. It's known as cleft palate. Cleft means something, some space between the palate. It's an opening in the palate. Understand? The cleft palate is also a side effect of anti-epileptics in pregnancy. So anti-epileptics causing 2 main side effects. Number one, neural tube side effect, neural tube effects. Why? Because these drugs also consume folic acid. They also consume folic acid. Understand? These drugs they also consume folic acid, causing neural tube. One thing neural tube effect, another cleft palate. Clear? Cleft palate, neural tube defect. Now you can now you have side effect in your mind. SIADH. Any other drug causing SIADH? Let me know. Any other drug causing SIADH?
Antidepressant.
Antidepressant. Good. Antidepressant which group?
uh,
Antidepressant which group? SSSSRI. SSRI. SSRI first one, okay? SSRI. Carbamazepine is a drug of choice for partial seizure. We can use partial. Another important thing you must keep in mind: trigeminal neuralgia. What the drug of choice for all aspect about carbamazepine done. Now we move on to another drug, phenytoin. Phenytoin and valproic acid. Always MCQ come in your exam about side effect of valproic acid and phenytoin. Phenytoin causing heuristism. Valproic acid causing alopecia. Alopecia, loss of hair. These two opposite side effects must keep in mind. Valproic acid causing hepatitis. This is the only drug in epileptic very strongly damage your liver. Okay, so if the patient using valproic acid, we must having LFT repeatedly. Patient must have this test. Okay, repeatedly have check the function of liver silver good or not. So these two side effects, rheumatism and alopecia. Rheumatism and alopecia, these side effects are totally opposite. Okay, must keep in mind. And another important side effect always come in exam: gingival hyperplasia. Phenytoin causing gingival hyperplasia. Phenytoin causing gingival hyperplasia. Clear? Phenytoin causing gingival hyperplasia. And what happens with fetal gingival hyperplasia important, rheumatism is important in fetal neural tube effect, and another issue in the fetus, phenytoin can cause neural tube effect. Okay, valproic acid can cause neural tube effect. Carbamazepine can cause. Why? Because they also consume folic acid. So in the fetal problem, fetal head and time syndrome, swelling, fetal hydantoin, hydantoin syndrome. Hydantoin syndrome. It's a swelling. It's a edematous fetus. Edema, edema develop in the fetus. Okay. Fetal hydantoin syndrome. Gingival hyperplasia. Rheumatism. Gingival hyperplasia. Rheumatism. Fetal malformation. Okay. Fetal malformation. Fetal malformation. Clear? So how they working? They block sodium. They also block glutamate. They also block. Very good drug to control the seizure. We can apply for partial. We also can apply for generalized. Okay. For tonic, also can apply for partial. Valproic acid. Valproic acid. What are the uses of valproic acid? We use for tonic-clonic. Okay. We use if any drug can control generalized tonic-clonic, it can treat any seizure. Carbamazepine limited action. Listen, valproic acid doing what? Valproic acid block sodium, valproic acid block glutamate, valproic acid stimulate GABA. Same three actions. So it's a more vast action. If the more vast action can control more severe seizure also. Yeah, because more variety of action there. Okay. So valproic acid, sodium, glutamate, GABA, also all action there. So we use for tonic-clonic seizure. Another very important use, if you remember, I already explained absence seizure. It also can use for okay. Carbamazepine never used for absence seizure. Okay, phenytoin not used for absence seizure. Why? Why this is important for valproic acid? Valproic acid acting on L-type calcium channel in the thalamus. Only valproic acid acting there. Another, the first drug of choice, only have action this anti-calcium methotrexate. The first drug of choice, if not written in your MCQ, Everyone know about the ethoxyximide or absence is a give ethoxyximide, absence is a give ethoxyximide. If you not found this option, then what will be your answer? Second option, you must use valproic acid for absence. Must keep in mind this thing, okay? Drug of choice for absence is a ethoxyximide. If you not found the in your answer key, okay, the option there, multiple choice option. If not there ethoxyximide, then you must pick valproic acid. If both answer there, then you choose what? Then you choose what? If both there. Ethoxyximide also there in option and valproic acid then also in option, then what will be your answer? Ethoxyximide or valproic acid? Let me know.
Ethoxygenide.
Ethoxyximide. Ethoxyximide, okay? If
Yeah.
ethoxyximide is not in answer, then valproic acid. Another use, third use, we use for migraine profile. Okay. If you remember, till now we have for migraine we having already using three drugs already done. From beta blocker, propranolol, tricyclic antidepressant for migraine, valproic acid for migraine. Okay, for migraine prophylaxis, valproic acid. For migraine prophylaxis, valproic acid. Tonic-clonic seizure, absence seizure. It can treat partial seizure, of course, can treat partial. If it can treat tonic-clonic seizure, any drug, of course, have ability to treat partial seizure. Okay. Understand? So what about the side effect? The most important side effect you must keep in mind alopecia. Which one? Alo alopecia. Clear? How about another side effect? You must check liver function. You must check liver function if you're using valproic acid. If you're using valproic acid, you must check again and again liver function. Done? For valproic acid, you must check because the valproic acid hepatotoxic. Valproic acid is hepatotoxic. Alopecia and hepatitis. These two side effects keep in mind. Alopecia and hepatitis. Regarding valproic acid. Regarding valproic acid. Understand? How about the common side effect of valproic acid, phenytoin, carbamazepine? These drugs can consume folic acid in pregnancy and causing what? Neurodepressive effect. Anti-epileptic drugs can reduce neurodepressive effect. More chances. Okay. So some books they saying that the carbamazepine causing neurodepressive effect, phenytoin causing neurodepressive effect. Some of them the books they write, pharmacology book they write. So in case of seizure in pregnancy, we can prefer valproic acid. Maybe have little effect on it. Okay. The phenytoin and carbamazepine, they 100% sure they causing fetal defect. They 100% sure they causing fetal defect. A bit safety about valproic acid. Safety about valproic acid. So valproic acid, hepatitis is a big thing. You must repeat the alert. You must repeat the alert. Three drugs done. Three done. Yeah. Phenytoin, carbamazepine, valproic acid. Next one. Ethoxyximide. You can write with this and you also can write this with X. Double serexin. Ethoxyximide is a drug of choice for outcome. So only thing to keep in mind for absence. Another give general idea about anti-epileptic drug. Anti-epileptic drug. This is a new thing for you. Steven Johnson syndrome. Steven Johnson syndrome. What is Steven Johnson syndrome? This ethoxyximide can cause it. Okay, Steven Johnson syndrome is a skin necrosis. Skin necrosis due to hypersensitivity. Okay, so drugs are hypersensitive. Ethoxyquimab can cause Steven Johnson. Clear? Steven Johnson's